Welcome, everyone. My name is Samir Kakodkar. I'm a gastroenterologist and specialist in ulcerative colitis and Crohn's disease. Welcome to Against the Grain. If you enjoy this interview, please do check out the rest of my podcasts, which can be found at the website samir3.podomatic.com, or you can search my first and last name either in YouTube or Twitter, and you can find more information there. On Facebook, you can search Against the Grain to join the private group where there are ongoing discussions about these podcasts. For information regarding appointments, you can email me at samir3@gmail.com. This show will focus on the effect of stress on Crohn's disease and ulcerative colitis. I will define stress as the feeling of being challenged by a threatening event or evolving situation. Everyone experiences some degree of stress in life, but when it becomes chronic and perceived as severe, it can have adverse health effects. Many patients attribute their initial diagnosis and subsequent flares to stressful life events. But does stress actually make the inflammation of inflammatory bowel disease worse? And I think that's the main question here. If we go back into the history of gastroenterology, psychoanalysis was thought to be an effective treatment for all sorts of bowel conditions in the 1930s through the 1960s. There was even a study published in 1958 reporting 10 of 15 patients being cured, and I put cured in quotes, of peptic ulcer disease, which means ulcers in the stomach or duodenum, with intensive psychoanalysis over the course of 3 to 5 years. Now, was this actually peptic ulcer disease? It's unclear because this was before the time where endoscopy was available. These could have been cases of functional dyspepsia, for example. Back then, inflammatory bowel disease was attributed to things like inadequate parenting, negative experiences, deprivation, family conflict, and sexual or physical abuse. These theories have subsequently been debunked. However, there are theoretical mechanisms by which stress can influence inflammatory bowel disease, and inflammatory bowel disease can influence stress. Many inflammatory conditions can trigger mood disorders, possibly through actions of cytokines on the hypothalamic, pituitary, and adrenal axis. Cytokines have been shown to produce depression-like syndromes in animal models. Stress activates mast cells and sympathetic nervous activity, which can be pro-inflammatory, although acute activation of the sympathetic nervous system can temporarily be anti-inflammatory. Stress inhibits the vagus nerve, which usually has an anti-inflammatory role through cholinergic activity. Stress increases corticotropin-releasing factor secretion from the hypothalamus, which can increase intestinal permeability. This can allow bacteria to cross the epithelial barrier and activate the immune response. Stress can also influence the microbiome, the bacteria that exist in the GI tract, and those subsequent changes can influence behavior and brain structures through the microbiome's production of catecholamines, acetylcholine, and serotonin. Short-term stress can increase the mucosal tumor necrosis factor and reactive oxygen metabolites, and it can also decrease the rectal blood flow in ulcerative colitis patients. There is a 2 to 3-fold increased rate of depression and anxiety in patients with inflammatory bowel disease, and this can precede the diagnosis by years. Depression is associated with the lower remission rate and more relapse of disease. However, the specific factors regarding how depression leads to those adverse outcomes are unclear. This potentially could be influenced by patients not taking their medication when they're depressed. High perceived stress is a predictor of increased symptoms in inflammatory bowel disease. The relationship between stress and symptoms is likely bidirectional. People with inflammatory bowel disease suffer the usual life stressors as the general population, things like finances, work, and family. I would also add to that the stress regarding following a strict diet, for example, especially if the patient doesn't want to do that. One study looking at the University of Manitoba IBD Research Registry showed that a major life event, high perceived stress, and high negative mood during the previous 3-month period was associated with flares, but there was no correlation with fecal calprotectin, which is a stool test that gives us really an objective measurement of if there's really inflammation going on or not. So they did not see a correlation with actual inflammation. Most studies do seem to suggest this finding, that stress may influence symptoms, but not the actual inflammation from Crohn's and colitis. I did find a study that was somewhat of an outlier, published by Levenstein and colleagues in the American Journal of Gastroenterology in 2000, which did show that asymptomatic patients with ulcerative colitis, so patients with no symptoms at all, but during their colonoscopy had active inflammation on biopsies, had a higher chronic perceived stress than those that were asymptomatic that had a normal colon. For those interested in more details about the mechanisms behind stress and inflammation, I really suggest you read a review article published by Dr. Charles Bernstein titled The Brain-Gut Axis and Stress and Inflammatory Bowel Disease, which was published in Gastroenterology Clinics of North America in 2017. And I'll put a link to that in the show notes, along with other studies that are referenced in this podcast. So what about Wim Hof? I've briefly mentioned him in previous podcasts, but he is known as the Iceman. He is an extreme athlete known for his ability to withstand freezing temperatures. He even climbed Mount Everest in his shorts without the aid of oxygen. So he has many really unbelievable feats that he has been able to accomplish. And he has a training program called the Wim Hof Method that involves meditation, breathing exercises, and cold exposure. I've actually gone through that training system myself. In a controlled trial, human subjects were injected with E. coli endotoxin. So that's a portion of the E. coli bacteria and other gram-negative bacteria that can really stimulate a strong immune response. And usually when you're injected with that, you develop fevers, chills, and you feel pretty miserable. And for the first time, this study showed that people were able to voluntarily activate the sympathetic nervous system with more secretion of epinephrine release and subsequent suppression of the innate immune system, with an increase also in certain cytokines like IL-10, which is anti-inflammatory, and a decrease in tumor necrosis factor IL-8 and IL-6, which are known to be, lead to more inflammation. And they also had less flu-like symptoms. So the subjects that were trained in this method and were injected with this endotoxin, they didn't manifest the usual symptoms you get from getting that bacteria in your blood system, like flu and flu-like symptoms and fever. But also they demonstrated that they were able to almost down-regulate their innate immune system. And they did not see those effects in those people in the control group who were not doing those things, the breathing exercises and the cold exposure. So it is worth noting that this has not been studied in the context of inflammatory bowel disease, which is a chronic rather than an acute inflammatory state, so it's really unclear. But what this study did show that it is possible to voluntarily and consciously potentially modulate your sympathetic nervous system in a way that can be anti-inflammatory. And that was previously not known and had not been demonstrated prior to this study being published. So what about mindfulness-based interventions? So you may have heard of things like mindfulness meditation and similar approaches, but mindfulness means focusing one's attention on the present moment in a non-judgmental way. And there are various techniques to achieve this, involving stress reduction, cognitive behavioral therapy, something called multi-conversion therapy, breathing techniques, and yoga. The data on these kinds of interventions suggest they can improve general and IBD-specific quality of life measures, also anxiety, depression, and self-reported mindfulness, but not perceived stress. And there's some criticism of those studies. They didn't see that the perceived stress improved, but it may be because a lot of the patient populations in these studies already were in remission at enrollment, so there may not have been much of a difference that they could detect. But importantly, no studies showed a significant difference in the change in clinical disease activity, time to flare-up, severity of flare-up, or rates of relapse. Also, there was no difference in need for IBD medication escalation. So those are important outcomes in Crohn's and colitis, and they did not see a difference. There were a few studies that showed some improvements in CRP, or C-reactive protein, which is a blood test looking at actual inflammation, although that's relatively nonspecific. But they did not see any changes in fecal calprotectin, which is a more specific marker of inflammation, mainly in the colon. And they did not see any significant changes in cytokines like tumor necrosis factor. But there was one study that may have shown IL-10, which is this anti-inflammatory cytokine, in patients who flared in the intervention versus control group of one study. But in summary, in the totality of the evidence published so far, it suggests that stress reduction does not decrease inflammation, but can improve symptoms and quality of life. So with that in mind, and that's pretty much kind of the summary of everything, but with that in mind, sometimes I do encounter cases that don't fit the mold. I have a friend who was diagnosed with ulcerative colitis. Later, the diagnosis was likely changed to Crohn's colitis, and this was several years ago, who reduced his stress in his life and didn't make many other significant changes, and subsequently had a normal colonoscopy with normal biopsies. So I reviewed the records and pathology results, and I'm confident that he was correctly diagnosed with inflammatory bowel disease. This was not a case of infectious colitis or ischemic colitis, these other types of colitis that usually get better on their own. So he will share his story with us today. As a disclaimer, this is not meant to be medical advice or a recommendation for you. Decreasing stress is not an FDA-approved treatment modality for Crohn's and colitis. This is simply an anecdotal story, and it should not be something that you should model your treatment on. I have seen many patients with Crohn's and colitis try to reduce stress with the expectation that this will by itself make the inflammation go away. And the vast majority of the time, this doesn't work and can lead to worse outcomes without also using appropriate medical therapy. This is a case that challenges this old saying that there used to be this old saying, once colitis, always colitis, in the setting of inflammatory bowel disease, without the use of medication or surgery. So cases of so-called spontaneous remission occur, but have not really been thoroughly investigated in my real review of the literature. This is one such case that I wanted to know more about. So that's why I thought it'd be valuable for us to all go through what actually happened. So let's see. All right. So we're going over this case of potentially a case of colitis that got better, presumably from stress reduction. So can you please tell us, as far as the date of your diagnosis was July of 2008, and we'll get into that scope and the details of that. But can you tell us some information about your life, what was going on, in the couple years prior to your diagnosis?
Sure. So July of 2008, I was maybe a couple years out of college. So in my early 20s, I was working at the time. And, I didn't have any, GI issues before then. But out of college, I started this job, and it was a pretty hectic job. I was, traveling a lot. It was long hours. It was sort of a high pressure environment. It was about a year and a half or a couple years into the job, and I started noticing some symptoms, like bleeding and all that stuff. And I sort of put it off for a few weeks. I mean, I thought maybe it would just sort of get better on its own, but it didn't. There was also urgency and all these other things that it came on actually pretty suddenly as far as those, visible symptoms. Mm-hmm. So I got a colonoscopy in July of 2008 and was diagnosed with colitis.
Okay. Before we get into the actual scope, can you just go into more details about the specifics of the job? That, why was it stressful? What was it about it that presumably you weren't happy with that situation?
Sure. Yeah. I think, it was a combination of things. I think, partly it was, in general, sort of a young person adjusting to a working life. I was only a couple years out of college, and I didn't really have a lot of experience in terms of, kind of real world, high pressure work environments. So part of it, I think, wasn't the job itself, but just adjusting to, a kind of completely different, lifestyle and environment. As far as the job in particular, it was, it was a management consulting job. It was, I had to fly Monday to Thursday every week, and it was like 80 hours a week. It was, working with clients. And I think, I worked a lot in college as well. So it wasn't necessarily the hours, but it was, on top of all that, I didn't really care much for the work, to be honest. Mm. So I think that itself adds another level of stress. I was kind of thinking I was just unhappy. It's not really where, what I really wanted to do with my life, where the direction I wanted to be going. And all that stuff, I think, kind of came to a head.
And you came from, one of the top universities in the country, probably the top one. And then I think your interest from when I knew you back then was different, right? Like you were into like kind of like the academic aspect of things, as far as like math and physics and even history, right? But then with the type of work where you're doing, was part of that stress that you weren't doing something that really your heart was into?
I think so.
Okay. Okay, so what about your diet? Your lifestyle back then? You were living, like, were you living in a city environment or suburbs? Like, where were you?
Sure. Yeah. So I was based in the city, and I would travel sort of Monday to Thursday every week. So, Friday to Sunday I'd be at my home, and then Monday to Thursday I'd be in some hotel somewhere. It was kind of all over the country and even abroad sometimes. So, my diet was awful. As you can imagine, when you're traveling so much, it's hard to, even shop for groceries and have a kitchen set up to cook. So, as a result, I ate out pretty much every meal, which is horrible, but it was sort of the circumstance.
Yeah. What sorts of places did you go? Like what?
I sort of ate just everywhere. I think kind of your usual foods, like in the city, like diners and that kind of stuff. But, for work, a lot of times we'd have to entertain clients. So, we'd go to nice places like, nice restaurants or like a steakhouse or something like that. So, eating kind of pretty rich, sort of, fine dining kind of food a lot, in addition to just sort of the usual kind of average eating out sort of casual meals. Okay. And, it was a mixture of everything. I didn't have any restrictions in my diet. I would eat, I ate meat, I ate starches, I drank alcohol. So it was pretty, there's pretty much no restriction.
Okay. And was there a lot of processed food in your diet too?
Oh, a ton.
Yeah. Okay. So the colonoscopy, right? So then you develop some, blood in the stool, July of 2008. And the reason I'm going over this data is, first of all, cases of spontaneous remission or patients with inflammatory bowel disease and physicians do colonoscopies and they see that it's normal. That happens rarely, but it's definitely something that is not well reported. This whole concept of spontaneous remission, or what they were calling spontaneous remission, where the disease just kind of just goes away and they don't really have an explanation. And I feel the tendency has been to, in the medical community, just to ignore those cases and just kind of people shrugging their shoulders like, okay, well, I don't know if that was the experience you had with the physicians that were treating you, but it's just, there's like no explanation and they just kind of monitor you. When really the paradigm has been, if there is inflammatory bowel disease, it usually doesn't just go away without doing something active. I mean, sometimes we see patients as they get significantly older, sometimes the disease gets at least less severe and may go into remission over time. But you're relatively young. I mean, you're in your 30s, right? So it's definitely not a common occurrence where the inflammation just goes away. So that's why I want to make it clear, because sometimes when these cases come up, people are like, oh, maybe it wasn't inflammatory bowel disease. Maybe it was irritable bowel syndrome or ischemic colitis or an infection. No, I've reviewed the records, and you've had these scopes done at top academic centers, IBD specialty centers, with specialty GI pathologists looking at it, and they've consistently called it inflammatory bowel disease. So this initial colonoscopy, which I personally saw the record of, the colonoscopy, your terminal ileum was normal. You had some inflammation in the cecum, which is considered what's called a cecal patch of inflammation. And then also inflammation going up about 15 centimeters, just involving the rectum. And the description of the inflammation was it was technically erythema, exudate, and loss of vascular pattern, which is overall a relatively mild amount of inflammation at that time. And the biopsies of the cecum, which is the beginning part of the colon on the right side where there was that patch, as well as the rectum, showed severe active chronic colitis consistent with inflammatory bowel disease. And specifically, they did see architectural distortion. What that means is the crypts in the colon, which are these kind of pits they see under the microscope, they were deformed. They didn't look normal. They look kind of like branched, and that's called architectural distortion, which suggests this is a chronic inflammation. Usually don't see that if somebody has an infection or like, for example, ischemic colitis. That's more suggestive of a chronic inflammatory process, which most of the time is inflammatory bowel disease. They also saw cryptabscesses and also inflammation focally involving the submucosal tissue, which to me is a clue that this could be actually Crohn's disease, because submucosal means it's involving not just the superficial layer of the colon, but going a little bit deeper than that. And that is a feature of Crohn's disease. So you get that colonoscopy, and then what happens next?
Sure, yeah. So, got that colonoscopy. I mean, to be honest, it was initially, obviously it's, a severe diagnosis and nobody wants to get the diagnosis, but I mean, it's a relief to know that you can, once you can put a name on it, and sort of come up with a course of treatment. So if I remember correctly at the time, I think for the, immediate situation, they put me on prednisone, for maybe a couple weeks, to sort of get the inflammation down. But, after that, it was, I started taking some medication like Lialda and Canasa. And, throughout all of this, I took like maybe a week or two off work. But, after that, I just went on the medication, and then went back to work. And yeah, in the immediate term, that medication was enough. And I felt, okay. I think there was still some, urgency, and still, I definitely didn't feel, 100% or anything. But I felt good enough to, go back to work.
Okay.
Yeah.
So you were kind of not 100%, but good enough to pretty much function at work and continue working. So did you do anything else besides go on the medicine? Did you change anything about your diet, lifestyle, or kind of went back to the way things were?
I did not change much. I didn't really know a lot about the disease, and in the immediate term, it was just a relief to have some medication for it. I was thinking, maybe over the long term, I would sort of investigate more into sort of alternative ways to handle it. But in the immediate term, since I found the medication was working, and I think even the physician said, that your diet it's not caused by diet, and it doesn't, diet doesn't have a big factor. I think so that just sort of led me to kind of maintain a similar diet as before, and just trust that the medication would be enough and sort of do the job, at least for the immediate term.
That's a common scenario, is when people get this initial diagnosis, they're told diet has nothing to do with it. And oftentimes we can be reassured by going on a medicine like mesalamine, which has a very good side effect profile for the most part. Most people tolerate it fine, and it does seem to work well in a lot of people. But there is a substantial proportion of people who do subsequently lose response. Like they respond. I've seen this countless times, especially when the diagnosis is a little bit questionable. Is it Crohn's? Is it ulcerative colitis? Because when people start on mesalamine for what's considered IBD unclassified or indeterminate colitis, they can get an initial response, and then for a subset of patients, they'll lose that response after a few months and then have to potentially escalate therapy. And one of the explanations that I can bring for that is mesalamine is really a medicine that works just on that superficial lining. So it is good for ulcerative colitis, and which just affects that what's called the mucosa, or the most inner lining. But when the inflammation extends deeper than that, the mesalamine may not be adequate to control that type of inflammation. So it's still used in Crohn's disease. Some physicians do use it, some don't think it's worth even trying. But when that inflammation at least appears to be superficial by the colonoscopy result, or when we look at it through the camera, then sometimes we still give mesalamine a shot. And that's something that I do because the side effect profile is so good. So then what happened? Like after that, you're on the mesalamine with somewhat of a response, and then what happens?
Sure, yeah. So I'm on the mesalamine, somewhat of a response. I sort of go back to work. I kind of keep the same diet and everything I had before. And then I think the issue was I had an abscess. An abscess developed. And this is, again, while I was sort of still working. And I mean, I didn't know what that was. I didn't know that. I mean, I assumed maybe it was related to the disease or something like that, but I wasn't sure. And then, yeah, I mean, it developed, it, got worse, and, I had to go and, get surgery to get it removed. And at the same time, also my symptoms were picking up, I think, before the abscess developed. There wasn't any blood, or it was infrequent. It wasn't as bad as it was before, but there was definitely, I think, some, urgency and that kind of stuff. So, my symptoms were not perfect. And then, I think they started getting a little worse as abscess developed. And then, it sounded like, okay, we need something else to, manage this, this disease. So I went in for, another colonoscopy to kind of get a better understanding of, what I would have to do, because it became clear that, what I was doing wasn't enough.
So just to be specific, this abscess was like a perianal abscess, right?
Right.
That had to be drained. And there were no fistulas, right, that you know of? It was just an abscess by itself?
No, I don't think there were any fistulas,
okay.
At least not at that point, yeah.
So that the presence of an abscess is also a clue that this is probably Crohn's, although there are some, I did actually do a search on this, can you get perianal abscesses with ulcerative colitis, and there have been some case series of that occurring rarely, like less than 3% of the time, with regard to a confident diagnosis of ulcerative colitis. So, but usually that is a clue that this is probably Crohn's. That isn't a common feature with ulcerative colitis. So, okay, so this colonoscopy, now this one you get done, I can say this one was done at one of the top IBD centers in the country. Uh, I mean, I won't go into specifics about like where this was done or who the physicians were, but the reason I say that is this is an IBD referral center for patients with IBD all over the world. Okay, so you can be confident in the pathology results and the competence of the endoscopist who was doing this. So the colonoscopy, the terminal ileum was normal again, meaning the small intestine was normal. And this is April of 2009. This is less than a year, right, after that initial colonoscopy.
Right, yeah.
So that showed moderate inflammation with congestion, erythema, which means redness, friability, and shallow ulcers to about 20 centimeters. And so involving most of the rectum, a little bit into the sigmoid colon. And the cecum also had similar inflammation, kind of that similar cecal patch was there. And as far as the biopsies, and this is according to a GI specialized, like someone who sees IBD path slides all the time. Cecum with severely active IBD and rectosigmoid with moderately active IBD. And the comment from the pathologist was features consistent with ulcerative colitis with the cecal patch, but given the history of a perianal abscess, Crohn's is a consideration. So, okay, so those are the results. What did they tell you after that? What did your physicians say?
Yeah, I mean, they started saying exactly what you're saying, right? That it's, could be Crohn's, it's indeterminate colitis. I mean, initially we thought it was just ulcerative colitis, even after, the pathology and everything. That was just the message we were getting from the physicians. But now, yeah, they started mentioning that, maybe it's Crohn's or indeterminate. And it was obvious that the, drugs I was taking at the time weren't enough to manage it. So then discussion was around, okay, what other therapies should I use to manage it? So I just basically changed the medication I was on. So I think I continued the mesalamine and the Canasta, and then I added azathioprine to see if that would, help with, the symptoms and everything like that. So, so that was ultimately what came out of it. And again, I mean, there wasn't really much discussion about, diet or lifestyle or anything like that. I mean, I began to start, that's kind of the moment where I began to start thinking that, stress may have something to do with it. And maybe it's worth actually kind of making a serious lifestyle change, in order to address, whatever stress. I mean, if not the cause of it, I could sense, personally at least that, maybe it had something to do with it or it exacerbated it. So those were kind of the two sort of ideas that sort of came out of it.
And what happened with the prednisone and the azathioprine this time?
Sure, yeah. Yeah, so I went back on prednisone for a couple weeks, and then then I went on azathioprine, and it actually worked out pretty well. My symptoms were reduced. I wouldn't say I felt 100% normal, but I felt maybe 80%. And there was no blood in the stool or anything like that. So it felt like I was sort of okay with the place where it was at. And the side effect profile of azathioprine was, I mean, it has obviously like some serious side effects in rare cases. But otherwise, it didn't like interfere with sleep, or it didn't interfere with, what I could eat and all that other stuff. So I actually, I accepted it as part of, having the disease. So it didn't really bother me necessarily too much to have to, go on it and stay on it. So, as far as the disease went, I started feeling better, shortly after all that. And then it also coincided with sort of the ending of my job. The program, I was in kind of a sort of management consulting program, which was a few years of work. And that was sort of terminating right around the time that this second colonoscopy happened. So I sort of thought I would use that opportunity to, take a break from this environment and see if, that would help with, the symptoms of the disease.
So this is a key point I want to focus on, is this concept of taking time off. And, amongst this coronavirus pandemic, everyone is taking time off now. But, previous to this, the concept of just taking time off, especially when you're in a busy work environment, it's not typical, even in the setting of disease. Now, I diagnose many people with inflammatory bowel disease, new diagnoses, and oftentimes it's young people who are working, who have families, who have kids, and they can't do that. They can't take several months off just to kind of focus on, what's going on stress-wise and psychologically, and also diet and lifestyle and that kind of stuff. They don't have the luxury of doing that. And oftentimes, I do think there is value to that, but it's just not a realistic thing. Now, at this point, you're not married, right? You don't have kids, and so that may have been part of the reason you could have done this, right?
Sure. Yeah, I absolutely agree. I mean, I was, I'm thankful to kind of have the opportunity to do that. And I know that's not very typical necessarily. And yeah, so I didn't have a family. I didn't have a kid or any kids. I didn't have, financial obligations or any other financial obligations that I had to uphold. So, that made it easier, but I would also say it wasn't necessarily easy, because I think there is, to do that was sort of going against the current of, what a lot of my cohorts were doing, and sort of I had to sort of give up certain elements of my lifestyle that come from an income or a healthy income. So, it was still a challenge in a way.
Sure, the opportunity cost is huge.
Yeah.
Giving up that amount of income. So, okay, so how does that all work? So you're done with your contract is up on this particular job,
sure.
and you decide to take time off. So what happened in that? And I believe it was like several months, right, that you took off. What did you do during that time?
Sure.
As far as what were the kind of realizations you came to with that time off?
Sure. Yeah. I was still in my early 20s, so I just moved back in with my family. And I decided that, I was wondering if maybe it was sort of the circumstances, like my work circumstances, that, created some of this underlying stress. So one idea I was thinking is, okay, maybe I can find a different circumstance that, I'd feel, something that I would be, more happy doing, or that would fit sort of my personality or my temperament better. So yeah, I just, and I decided I would think about that and start working towards that. And I wasn't necessarily in any rush to, figure that out, because I also thought that just, time away from that would be beneficial, just to, create some space, right, to sort of even think about some of these things. So yeah, what did I do? I mean,
we used to play tennis.
Yeah, we used to play tennis.
Right.
So yeah, I did that. I mean, tried to, spend a lot of time outdoors. I did a lot of reading, did some writing like that, that kind of usual stuff. And yeah, I managed to sort of fill the time. And, months went by. And then, it got to a point where enough months went by where, I felt like it was probably, time to actually do something again. Because even, I think, one thing, I learned is that, even in that situation, there is sort of an element of some kind of stress sometimes, because you're not doing much and you feel like you should be doing something, right? You feel like maybe you're not moving anywhere, you're not going anywhere, and maybe everybody is sort of doing things and moving on with their lives. So even that sort of creates an element of stress. So it was a good experience to see that whether you're working or not, there is always a possibility for this kind of stress. So I felt at that point ready to sort of go back and do something, and then I started another job. I moved cities, started another job, a little less intense than what I was doing before, but kind of similar in terms of the work. And as far as my disease was going, it was sort of being managed okay. I was still on the azathioprine and didn't really have any other issues. So
you, just to go back a little bit, so you
sure.
took, how many months total did you take off where you were kind of just self-reflecting and?
It was maybe a lot. Could be like 7 months.
Okay.
7 or 8 months.
And you were on the azathioprine the whole time during that?
Yes.
Is that right? Okay.
Yeah.
And anything during that time diet-wise change, or pretty much, from my understanding is the diet really, you definitely were not following any dietary protocol, like nothing like the specific carbohydrate diet, nothing like paleo or plant-based whole food, nothing like that, right? You were just pretty much following what would be considered a normal diet, like Western diet, right?
Right. Yeah. I did not follow any protocol. But I do, I was living back with my family. So, I ended up eating out a lot less. And I ended up drinking alcohol a lot less.
Okay.
So it wasn't necessarily like deliberate, but, those changes happened, and I think maybe they helped with the symptoms.
Okay. But not like a drastic change that we are used to.
I still ate out a couple times a week, and
and you still ate like processed food occasionally, right? Yeah.
Yeah.
Okay. So I wouldn't consider that to be necessarily a dietary change, because I know a lot of the questions on Twitter were like, "Oh, what was his diet?" Maybe that's the explanation. But what I'm trying to emphasize is that he's not doing like some crazy protocol, which I feel like. My philosophy has been taking the processed food out is really the common element to all the IBD diets. Yeah. But even that you weren't like doing that 100%. Maybe it was a little bit less, but for the most part, you were still eating processed food. Okay.
Eating a lot of processed food, eating out, even eating like fast food. So.
Right. Okay. So you go back to work, and you're still on the azathioprine at this point. And you can describe what happens from there, but from my perspective, it seems like you're pretty much lost to follow-up. You don't follow up with physicians for like several years after that, right?
Yeah.
Okay. Yeah. So give us the progression. What happens? You're in this new city. You're doing work that you're a little bit more invested in. Would you say that's fair?
Yeah, eventually, yeah.
Okay. So then what happened?
Sure. Yeah. Yeah, you're right. I wasn't very good at following up with my physicians. When I was feeling okay, I just wouldn't, be very proactive about scheduling any appointments or anything. So, yeah, I was on the azathioprine. I kind of went to a new city, and I was sort of managing okay, and sort of involved with work. And then I felt well enough that I was just curious if I stopped taking the medication, what would happen? It was more of a curiosity than anything, really. I wasn't sort of dead set on getting off of it, because it wasn't, it honestly didn't have a lot of, side effects, or at least day-to-day side effects. So I was just curious, like, okay, if I didn't stop taking it, and it may have been even that I didn't like fill it like 1 month and I just sort of stopped taking it. And I think what happened was that I found myself, still feeling okay. And then I figured maybe I'll be okay off of it. And it just sort of just fell off. It wasn't really planned. And also at this time I was sort of continuing some of these practices to kind of reduce my stress. I mean, I started meditating pretty regularly, and that was I found to be sort of very beneficial. And I, in my work, I was, trying not to get too caught up. I mean, of course, there were many times where I still had to work pretty intense hours, but it wasn't nearly as intense as it was before. So it was kind of a gradual leveling off, I guess.
And when was what year did you stop the azathioprine roughly? Because again, when you had that colonoscopy in April of 2009, that's when it was started. So roughly, you said you were on it for like a couple of years?
Yeah, I would guess maybe 2011, 2012.
Okay, so you had stopped it. So, and I do want to get into your kind of your method of meditation and what you specifically do, but sure. Just to go over, because there's some people who are going to say, oh, he was on medication, so maybe he just got into remission and eventually he's going to flare later on because that was really what was responsible for him getting better. So let me just go over the data. The data for azathioprine when you stop it, and there's been a lot of different studies, some well done, some not with not great methodology. But in Crohn's disease, the relapse rate if somebody's in remission on azathioprine, from anywhere from 1 to 3 years, it varies between 16.5 and 53%. If you're just on azathioprine and you stop it. For ulcerative colitis, it's 60%, over the course of anywhere from 1 to 3 years. Now, it's a very famous trial called the STORY trial, which looked at Crohn's disease. And those were patients who were in remission on both azathioprine and infliximab, which is Remicade. So they were taking both of those medications together, which we sometimes do. And of those people who were in remission, after 1 year of just stopping actually the infliximab, the Remicade, 50% had a relapse within 1 year. And then they extended that analysis over the course of 7 years. And only about 21% did not require restarting the infliximab. So we're not specifically talking about azathioprine in this context, but here we're using very potent immunosuppression up front. We're stopping the biologic, which in the setting of Crohn's disease, infliximab is thought to be superior to azathioprine by itself for Crohn's disease, according to the SONIC trial. And over time, the vast majority of the people required restarting the medicine. So that's just the context of de-escalating medicine and over time what likely happens, which is a flare. So you stopped the azathioprine in 2011, and my understanding is you didn't see another gastroenterologist until 2017, which that's 6 years off therapy. Is that right?
I may have seen one in. There may have been like one appointment or two appointments, but it was they would just have been sort of checkup appointments. I definitely didn't have any like scope or anything in between that.
Okay. So you said you were doing some stress reduction techniques. So can we go over those and specifically what you were doing?
Sure. I mean, I would say the main thing was kind of the sitting practice of meditation. So that I found to be very valuable. I don't know. I think I just read a book about it. That's sort of how I kind of fell into it. But I found it sort of very beneficial to sort of kind of work with whatever stress or whatever thoughts that were arising. So I would do it, sometimes just like 10 minutes in the morning, or 30 minutes here and there. But I tried to keep it somewhat regular. So I tried to do a little bit of it at least, most days of the week. And I would say that was probably the main thing, aside from, just keeping a balanced lifestyle.
Okay.
Yeah.
And there are different ways to meditate. Some people will focus on their breathing. Some people will, focus on a certain object. There's even open eye meditation. And so what is the specific practice you do? If you can just briefly explain what you're doing.
Sure. Yeah. It was just sort of focusing on breathing, and like kind of very simple. I sort of read a few different books, and I mean, it seemed like the common denominator for a lot of them was just like focusing on the breath, and there's various details that were very different, but that seemed to be kind of one of the more common approaches. So I figured, why not do that? And I didn't try I didn't sort of try and focus too much on the particulars, but just sort of the general kind of practice. So that's really all I would do. In the morning, I would just sit down. I got like a little cushion, and I would sit, kind of just Indian style or cross-legged, without, while still feeling pretty comfortable, and then just sort of, kind of rest my hand in my knees and then close my eyes and just focus on, the breath, for 15 minutes. I would set like a timer on my phone for like 15 minutes. And then, I would just sort of do that practice, focus on the breath. And then if thoughts or whatever else came up, I would, just try and, not sort of, get too caught up in them, but just try and notice them and sort of let them go and bring, the attention back to the breath, sort of over and over. And initially it didn't really feel like doing much, and I didn't really see much coming out of it, but it just seemed like a nice sort of relaxing way to start the morning or something. So I just kept going on with it, not expecting too much. And then I think over time, it really started to sort of pay off, sort of its benefits, and allowed me to sort of just kind of relate to whatever stressors or whatever comes up, in sort of a more balanced way, if that makes sense.
Yeah, I'm appreciative that you mentioned this, the time frame of it, because I think some people who try meditation expect quick benefits and will give up on it if they try it for a week or so and they're not seeing that their blood in the stool went away, Yeah. But what's unique about what you said is that eventually it really wasn't about using it for the disease. It was more like, this is a good thing for me to do. It really doesn't matter one way or another. I'm not going to focus on the disease per se, but it's just something I'm going to do. And then that's a very interesting concept. I know we talked about this before, about doing therapies or targeting therapies for the colitis and being very intense. Like it's almost like a war on the colitis. Like I'm going to go on this strict diet. I'm going to do this protocol that's very, austere, very, I'm pretty much going to live like a monk and just, I'm going to take care of this. Versus, and that's kind of been the approach with, even you can think about like the war on cancer. It's like this very militant, almost violent imagery, like I'm going to take care of this. But what you're describing is kind of this shift in this approach where I'm not going to so focus on the colitis. Like the colitis is there. I'm not going to really allow that to focus my attention on that particular thing, and I'm just going to do things that I think are generally good for me. And then it was almost like a secondary effect as far as the colitis getting better. And it really wasn't even your intention. That wasn't the purpose of doing this at all.
No, not at all.
Yeah, cool.
Yeah, that's right. And I think part of it is like, there's the practice of meditation, and then there's also sort of the philosophy, kind of going back to what you're saying is, when you have a war on something, you think about it, there's a lot of like kind of thoughts involved with that too, right? That, I have this disease, the thought that, I have this disease is bad. I mean, and, it's hard to avoid these thoughts. I mean, we all have them. But it's a sort of a means to just kind of just notice those thoughts and not get too fixated on them is how I found, the philosophy to sort of be beneficial. But yeah, I mean, it's just sort of going back to what you're saying. I mean, this war mentality of, this is a bad thing, I have to beat it. It's meditation kind of is it's not necessarily opposed to that, but it's not necessarily in line with that either, I would say.
So then, you do it once a day, or do you twice a day?
Well, I mean, it evolved. So initially it was just like once a day for a few minutes. But where the point it got to, and I still do it now, is I do it in the morning for some time, and then in the evening, kind of after my work day, I'd spend a little time doing it.
And what are the benefits you've noticed?
I think it's beneficial in a lot of ways. It's like hard to even say. I mean, I think the main thing was just relating with sort of these kind of stressful situations is probably one of the big benefits I found, is that usually previously for me, kind of in a stressful situation, I wouldn't necessarily, there'd be a lot of thoughts associated with it, and it'd sort of be overwhelming. And you'd kind of, I'd sort of have to sort of power through it, and just sort of kind of grit my teeth and sort of just go through it. I mean, of course, I still have those, situations now, but I found that it sort of helped, manage those situations where you can kind of see, the various thoughts that arise when dealing with like a stressful circumstance, whether it's, work or family or, whatever it is, and not be overwhelmed by them. So, that's sort of a major benefit. And I think it just has given a different perspective on, what ultimately, is important. I think is important to do with, my life or something like that. So it's hard to sort of articulate even, but as far as practical benefits, I'd say sort of dealing with stressful situations, having a little more clarity in decision making, and even an interesting thing I noticed was that as kind of this sort of viewpoint change and the ability to sort of work with stress change, I noticed that my diet would kind of change naturally, and I. Not only like I wasn't as interested in eating some of the foods I was, I would eat before. And, I found that when, after, practicing meditation for some time and then the mind is maybe in a calmer state, I'd want to eat sort of more nutritious foods. And it wasn't even deliberate that, I should be healthy, I should do it. But I just naturally sort of craved or wanted sort of more, healthy or nutritious foods or whatever. So, that's another benefit. It was, and these are, I guess, very fundamental sort of things. So, in sort of all circumstances, it's sort of found its way. And, I'm very appreciative of it. And, I feel like it's really added a lot. Or helped a lot in my life personally.
Okay, so you're off azathioprine since 2011. You're doing this sitting meditation practice. Yeah. It's done a lot with regard to stress, your diet. You didn't change your diet for the purposes of the colitis. It kind of was just like a natural sort of evolving phenomenon from the meditation. You just felt like eating more nutritious food, but still you wouldn't say you're on like one of these protocols, right? You're just, what is it? Like you're just overall trying to eat a little bit healthier. Is that what you would say? Or like what sorts of things were you eating less of?
I was just eating out less, or eating, I mean, you know, I would eat like a lot of pizza and burgers. I mean, I'd still eat that, but I think I would eat that a little bit less frequently.
Okay.
And yeah, so I would eat out less. And I guess the other thing I did was I cut down a lot on alcohol. So this was maybe in 2013, 2014. I started cutting back on the amount of, alcohol I was drinking. I was living in a city at the time and going out, a lot of days of the week, and, going to restaurants and I cut back on alcohol, not necessarily, for the disease, but I felt like, with my sleep and all this other stuff, I felt better when I would not drink as much. So, cut back on that. And then, the other thing I cut back on was caffeine. I ended up, drinking not as much coffee. When I was working for a couple of years, I was drinking like a ton of coffee. And I sort of cut back on that too, to, help with the kind of the sleep and just overall feeling, of kind of digestive well-being. So.
And how was your sleep? Did your sleep improve over this time?
Yeah, gradually. It was, it wasn't perfect, and it's still not perfect, but it definitely got a little bit better. So yeah, there were some nights where I had trouble sleeping, and I would, it wasn't perfect, but it definitely improved. Okay.
Anything else significant happened between the next data point I have is March of 2017, when you had a colonoscopy at another, top IBD, considered a IBD referral center, has IBD specialists there who you did see. So tell me about that. Anything happened before that?
Like various things sort of just growing up. In terms of, I was sort of growing from a person in his 20s into his 30s. And, just like everybody, I had sort of my own, journeys in my personal life as far as relationships and family and those kinds of things. So there was a lot of, I would say there was some growth there. I hope there was some, a little bit at least. But yeah, there wasn't, there wasn't like any sort of particular sort of event that I would say that is kind of relevant. So.
Okay. All right. So then let's go over the colonoscopy then, okay? Sure. In March of 2017. Now, at this point, why did you get the colonoscopy? Because it seemed like you had been lost to follow-up for... 8 years? You said you had some couple follow-up appointments, but definitely no scope in that interim.
Yeah.
So what made you go ahead and get the colonoscopy? Were you just curious, like what's going on? What it may look like at this point?
Yeah, part of it was like curiosity. And I would say that is sort of how I've always kind of related with the disease, is I've just been kind of curious. About it, and I was curious to see if it was better, and I think also there's guidance to get a colonoscopy every few years, and at that point it had been so long that I felt like, okay, I probably should, just for screening purposes and that kind of thing. So it wasn't due to symptoms. It just felt like I waited so long, it was probably a good time to do it.
Okay, so the colonoscopy, normal terminal ileum, as it has been, and then there was some inflammation, pretty mild, granularity and punctate erosions in the ascending colon, which is the right side, which you hadn't had before.
Yeah, I thought that was strange.
And this was, just distal to the ileocecal valve, extending for about 7 to 10 centimeters. The pathology from the ileum, again, was normal. Then the right colon biopsies showed mildly active Crohn's colitis with cryptitis, and the rest was all normal. This was read by a specialized GI pathologist, and they were calling it Crohn's colitis. Rest was all normal. Okay, so then that happens. What does your physician say? Because you're not on therapy.
Yeah.
You're not having symptoms. You've got some mild inflammation. So what did they say at this point?
Yeah, they said essentially that if I was feeling okay, then there isn't any absolute need to go on therapy. They mentioned what you said. They said there's some mild inflammation, but if you're feeling okay, then you can try it out and see how things go without therapy, and you can always sort of get back on it if you need it. So I was doing that anyway, so it wasn't really too much of a surprise or anything. But yeah, and also I say at that point, kind of when the disease has been in sort of symptom free or has much less symptoms for quite a while, that's around the time actually I became more interested in sort of diet, just like kind of improving my diet, as far as just in general, and as far as the disease went, which is strange. You would think that, I'd be kind of very interested in doing it at, when I was in a kind of severe state, but it was around then, we kind of had discussions around diet, and I found a physician, luckily, who, was open to have that conversation. I know not all of them are open to having it. So, then I sort of just continued what I was doing before.
Okay. And what did your diet evolve into?
I started reading some of, the books around the SCD diet and, these other types of diets, because it seemed like if it helps with colitis, maybe there's just something kind of like fundamentally good about the diet in general. I think, it seemed like they had a lot of advice that was just good to follow for anybody, which was, kind of reducing the amount of processed food, reducing the amount of, preservatives and reducing the amount of meat intake. So that's kind of basically what I did. I started eating a lot less processed food. I started eating less meat. I started eating, just more fresh food. So it was, again, it's like, it's not really a protocol. And it wasn't really, I would say, like specific to, IBD. But yeah, I just started improving my diet in those areas.
Mm-hmm. Yeah, I think you had mentioned you're eating. Would you say it's kind of similar? I know you've listened to some of the other podcasts on this show, but the one I did with Dr. Chiba, the Japanese diet, kind of similar concepts to that, where you do eat rice, right?
I do eat rice. I eat starch. I still eat kind of red meat on occasion, and I still eat processed food, just like less of it.
Yeah.
Pasta. I still eat like all that stuff.
Like, do you eat stuff like Snickers bars or, like cereal or candy and chips and crackers? Do you eat that kind of stuff too, or?
Sometimes, yeah.
You still eat that? Okay.
Yeah, I still eat it. Not as much as I eat. Maybe I just ate like a ton of it before. now I eat like a normal amount. But yeah, I still eat, chocolate chip cookies, like potato chips. I'll eat ice cream. I eat it all in moderation. I won't like house a bag of it. But and I still eat chocolate. It's cereal sometimes. So I do still eat it, like a couple times a week or a few times a week. I'll eat something like that, but not a whole lot, not as much as I used to.
Okay, so I guess it's debatable if that could have had an effect, if anything, an adjunctive effect to the stress reduction methods you had. And I mean, because I feel like most people who've gone the diet route have to be pretty strict. I'd say most of the people on for example, the specific carbohydrate diet, if they go off the diet just a little bit, they at least notice significant symptoms coming back. It's debatable if that's actually inflammation or just intolerance. But you're definitely not following really any protocol, because none of them allow those even like occasional amounts of what you're describing. So, but it's still sort of in that trend. Okay, so people must be wondering, okay, why is this a story? Because so far there's been inflammation on all the colonoscopies, but the most recent, this is the data point that was surprising to me, was that February of 2020, right? You had a colonoscopy, and from what you told me, this was also just out of curiosity, right? You just wanted to see what was going on, really wasn't having any symptoms.
Yeah.
And this was done at one of the same places. This was actually where you had the one in April 2009, where they were confidently calling it, they were saying ulcerative colitis, but given the history of the abscess, possible Crohn's, but they were pretty confident on a diagnosis of at least inflammatory bowel disease. You went back to the same place in February of 2020. You got a scope by a specialist, inflammatory bowel disease specialist, normal colon, normal terminal ileum, biopsies completely normal, read by one of the top GI pathologists, I would say, in the country, especially within the context of IBD. So I don't think there's any debate that at least at this point, there's no inflammation in the colon. So what happened between March of 2017 and February of 2020? Is there anything that comes to mind besides diet, stress-wise, your work? What happened that was different?
Sure. I mean, I think it was just a continuation of sort of everything that was going on before. I mean, I continued sort of the sitting practice of meditation. I continued on in terms of trying to find sort of work that kind of fit, continued to fit as I evolved. So I changed my circumstances. I actually went back to graduate school, in my early 30s. And
talk about that decision. Because that's not typical to go back to school after being pretty much working for a long time, to actually go back to school, and that decision. And
yeah, sure. I mean, from the beginning, I always kind of felt that there, some of the stress was perhaps due to at least in my case, maybe it was a disconnect between what I was doing and, what maybe I, deep down kind of had a affinity for or a temperament for, that, maybe this disconnect was the source of some stress. So, trying to close that gap was kind of, informed a lot of the decisions that I made, over the course of the last 10 years. And this seemed to be sort of another step in that. I like you mentioned, when I was younger, I was kind of very interested in some of the, some academic problems and kind of certain areas of math and computer science and physics and that kind of thing. So I'd always wanted to sort of go back and do that. And it was a hard decision because, I'd been working for quite a while. Again, I didn't have a family or kids, so, I still had some freedom in that regard, but it was a hard decision to sort of give up kind of work and even my career. Like, I had advanced in my career to some certain stage, and to sort of go back to grad school. But it's one of those things where it felt like it was something that I would want to do and would be a kind of a meaningful endeavor. So I did that, and I think so that was a kind of a major lifestyle change that happened between the 2017 colonoscopy and 2020, maybe the main one. Probably the main one. In addition to sort of keeping up all these other practices and lifestyle.
Okay.
Yeah.
So great. There's the story. Instead of publishing this case in a scientific journal, which they would probably reject it anyway, because it doesn't seem like the medical community is really interested in these kind of cases. But there you go. Now the audience can be you can be the judge as far as what you think was possibly responsible for this, what the medical community would term spontaneous remission, because you have a normal colon when previously you didn't, and you're not on medicine. And just according to the data, I'm very doubtful that the azathioprine was responsible for you healing the inflammation between 2017 and 2020, because you weren't even on the medicine. I mean, you'd been off of it for several years prior to the 2017 colonoscopy. So I don't think medication had any influence between those two scopes. There's like really no way that would be the case. Your story reminds me, and I've done a lot of podcasts up until now, and we'll see if I continue to do them. Hopefully I do, but usually I make a decision to do a podcast if I have some sort of I'm interested in something and there's somebody I want to talk to, and I feel like I've talked to a lot of the people that I wanted to talk to over the last 2 years of doing this podcast, and one of the things that comes to mind, two come to mind. I did a podcast with Jack Cruz, which was a relatively controversial one. And one of the statements he made is you can never get well in the same environment that you got sick in. Okay. And what he was more referencing was, the light environment and your distance from the equator and UV light. And it got very technical with his quantum biology background. But from your perspective, it's relevant that you can't get well without changing not necessarily the environment, but the mental environment, and how you're functioning, and almost like the way you think and how you perceive stress from the external environment. And that's something I think you actively worked on and helped to fix. It's debatable, as I mentioned in the beginning of this podcast in the intro, that the research so far suggests that doing these kinds of things, meditation, mindfulness meditation, yoga, they don't affect the inflammation. They've done studies looking at, objective parameters like fecal calprotectin, and they haven't seen a difference, although people's quality of life gets better, their symptoms get better, but the actual inflammation doesn't seem to correlate with that. But this is the problem. Like this, your case, in your particular case, it seems to have had significant benefits, and now we have objective evidence that the colon looks normal. Is that a combination of diet and your meditation, or would it have happened anyway? That's another question. If you didn't do anything, like you continued to eat the way you were eating, and it didn't really work on your reducing stress in your life, would the colitis have kind of like burnt out and went away anyway? And again, that's like not typical. It's extremely rare. And another thing is, I don't want this story to encourage people to go off their medicine or do necessarily what you did. I'm totally for your approach, as long as people stay in touch with their doctors and continue the medicine that they're on. And there are certain parameters where we can carefully monitor you when you're going off medicine, but I definitely wouldn't recommend being like off the radar for several years. But definitely with the coronavirus pandemic going on, people should not be stopping their medication, because the worst thing is the odds are you will flare, you'll end up in the hospital or require steroids, and that can lead to a bad outcome, you potentially dying from this. So this is not the time to experiment with. I think meditation is going to help people in general, no matter if you have IBD or not, in these times, these very stressful times. But I wouldn't change what you're doing. This is obviously not medical advice. We're not recommending this. But I still like to bring attention to cases like these, because nobody else is. As I said, physicians kind of just shrug their shoulders and say, all right, whatever. And has that been your like when you had this colonoscopy, this most recent one that was completely normal, what did your physician say? Did they look surprised? Did they look, or what was the response?
I think it was sort of a new physician, and They just sort of said, okay, maybe come back in a few years to do a screening for, another colonoscopy for, screening for colon cancer. But no, they didn't really say anything. I think it's not so interesting,
Yeah.
in some ways.
I mean, it should be. It should be interesting because the odds of somebody healing up their colon like this, in general, for, I would say, more moderate to severe Crohn's, with the best medical therapy is 40% or less. And you weren't on any medical therapy between these two scopes. And it just went away. So I mean, and it's no guarantee that it won't come back either. That's
right,
another thing.
Absolutely.
So it'll be interesting to see how things go. I'm hopeful and optimistic that it will continue to be in remission. So, but we see these cases. I saw a patient of mine relatively recently. She had very severe Crohn's, really bad symptoms. I think I've had at least 2 patients like this. And same thing. And these two really didn't do anything different. I think one of them did mention meditation, but they had required biologics in the past. They had fistulas and stuff like that, and then they had this long period of time where they didn't have any symptoms. But I don't think they had objective evidence of healing like you did. And then they came to see me recently just to kind of get a scope because their primary care physician recommended it. And so it's not uncommon, but I just want to shine a light on it to see like what was going on. So, but thank you for sharing the story. Was there anything else that you wanted to share that you didn't get a chance to, or any comments?
I think that's sort of basically it. And I think, kind of what you were saying before, like treating it as, a war, like trying to, win against it. I didn't necessarily have that perspective. And still, I also don't necessarily feel like I won anything necessarily, because like you mentioned, it's hard to predict with this disease. I'm aware that there is a possibility that it might come back. And so I'm not, I don't necessarily feel kind of fully like, I've beat it, because it can come back. And I also don't want to give the impression that I'm like disease free necessarily, because I'm, I have heart disease in my family and all these other things. So I recently started taking, some medication for that. So it's, I think it's an interesting case, and I like you said, I wouldn't. I only kind of share it, not to necessarily. I would not necessarily advise anybody else to sort of follow like the exact path that I did, but I think it's. We'll see how it goes. This is kind of the philosophy or the mindset I have about it.
Yeah. Well, just to be complete, if we're going to treat this like a case report. So you started taking a statin, right? Like a cholesterol medicine.
Yeah.
Is that right? Okay.
Yeah.
I have not gone into the details about that, but my understanding is there isn't really any evidence that has an effect on the colitis itself. So I wouldn't attribute that to be a primary treatment for colitis.
I didn't take it until after that colonoscopy.
Oh, there you go. Okay.
Yeah.
I know there's some data about it being used to like prevent colon cancer, and there's been some, I'm just going off the top of my head. I haven't looked, don't hold me to that, but yeah. Okay. So then it's not even relevant. It was taken after the colonoscopy. Okay. So yeah, I gotta learn how to meditate, but I've tried to meditate myself many times in the past. And I think my problem has been that issue where I'm like expecting some tangible results pretty early on, and I don't get it. And then also people have like limited time in the day, right? You have to choose like what you can do with the limited amount of hours in the day. And some people choose they're going to focus that energy on cleaning up their diet to the maximum effect. And that takes time. Like you have to cook, you have to prepare, you have to go shopping more often. Some people want to, go more the exercise route. Like they're going to spend their time like lifting weights or, build like bodybuilding or doing cardio, and then that can take time. And then there's meditation as well. And so to do all of those things well is difficult. But I don't think it's too much to ask anybody to carve out 15 minutes in the day to do this. And we'll see. I mean, there's definitely been many health benefits ascribed to it outside the context of inflammatory bowel disease. But I don't think anybody's out there saying don't meditate, like it's bad for you. So I think it is something to consider. So thank you. Thanks for sharing your story, and it will now live on in infamy.
Thank you for having me.
Okay. All right. Thanks.